Retatrutide is a triple G agonist of the GLP-1, glucagon, and GIP receptors. As I blogged previously, and check out that link in the post below, top-line results of the TRIUMPH-4 study of retatrutide for knee osteoarthritis in people with obesity revealed clinically important improvement in knee osteoarthritis pain and weight loss of 28.7%, about 71 pounds, with the highest dose of 12 milligrams weekly for people who took the 12 milligram weekly dose as intended through the trial. Top-line results of the larger TRIUMPH-1 study have just been released and has reinforced the existing knowledge base of retatrutide to provide really impressive weight loss results. This was a phase 3 study of 2,339 people with obesity randomized to receive retatrutide at a dose of 4, 9, or 12 milligrams weekly versus placebo. At 80 weeks, weight loss was 17.6% with retatrutide 4 milligrams, 23.7% with 9 milligrams, 25% with 12 milligrams, and 3.9% with placebo. The study also looked at longer-term weight loss in just over 500 people who completed the main 80-week study and tolerated their assigned dose of medication. In those people, the study found that the weight decreased further by the 2-year mark for a total of 25.7% with retatrutide 4 milligrams, 28.7% with 9 milligrams, and 29.9% with 12 milligrams. For people who took the treatment as intended, people on the highest 12 milligram dose lost an average of 28.3% weight, over 70 pounds over 80 weeks. People with a body mass index or BMI of at least 35 at the start of the study lost an average of 30.3% weight, which was 85 pounds on average at the 2-year mark. This degree of weight loss is aligned with what we typically see with bariatric surgery, like gastric bypass surgery. Metabolic health improvements were seen with retatrutide, including blood pressure, cholesterol, and improvements in inflammation, or HSCRP. From a tolerability perspective, retatrutide is showing overall a similar range of GI side effects as with other GLP-1-based treatments. According to the press release, with retatrutide 4, 9, and 12 milligrams respectively, there was nausea of between a 28 to 42% versus 14.8% with placebo. All detailed numbers are in my post below. Diarrhea ranged from 25 to 34% versus 13% with placebo. Constipation, 23 to 26% versus 10% with placebo, and vomiting was 10 to 25% with about 5% with placebo. There was also this dysesthesia or altered skin sensation, which we've seen now in several studies of highly effective GLP medications. I blogged on that before, link is in the post below, and that was seen with retatrutide here at 5, 12, percent range with about 1% in placebo. They also noted a higher likelihood of urinary tract infections with retatrutide for reasons that weren't clear. One could speculate that if a person were to become dehydrated due to GI side effects, that could maybe increase the risk of urinary tract infections. However, urinary tract infections haven't really been seen in more commonly in other studies of GLP-1s, despite similar GI side effect profiles. So we'll need to dig into that a little more. There were numerically slightly higher upper respiratory tract infections as well. And I really look forward to the full publication to learn more about these findings. And again, all the detailed numbers are in my post below. The percentage of people stopping treatment due to adverse events were quite low compared to placebo. So why is retatrutide so effective for weight loss? Well, as a triple G, it stimulates the receptors of 3 naturally occurring hormones involved in appetite and metabolism. While each of these is a long topic unto itself beyond the scope of today's post, in brief, GLP-1 decreases appetite and cravings and slows stomach emptying. GIP decreases appetite and may have benefits in fat tissue. Glucagon decreases appetite, slows stomach emptying, might increase energy expenditure based on animal data. We need more information on that, and there are benefits to liver health as well. With such robust weight loss findings, I really want to point out again that for all weight management medications, we need to find the right dose for each person. As we talk about in our Obesity Canada Pharmacotherapy Clinical Practice Guidelines, I'm the lead author of that, we should titrate weight management medication as needed, as tolerated, and as appropriate to help each person achieve their treatment goals. This includes watching for weight loss that might be too much or too fast, and decreasing medication or sometimes pausing treatment to avoid excessive weight loss. For some people, the weight loss seen in this retatrutide study would be welcome and beneficial to improve health and well-being, but for some people, this amount of weight loss would be way too much. So personalizing treatment is really essential. So the bottom line here is that based on these top-line results, retatrutide has again demonstrated previously unsurpassed weight loss, now well into the range achieved with bariatric surgery. As for other highly effective weight management medications, if or when retatrutide becomes approved for use, it will need to be titrated carefully as needed, as tolerated, and as appropriate to help each individual achieve their treatment goals, and being cautious to avoid excessive weight loss. As a disclaimer, I am an investigator in clinical trials of retatrutide. I receive honoraria as a continuing medical education and speaker from the consultant and as a consultant from the maker of retatrutide, which is Eli Lilly.